Hi, my name is Paige Tony, and we're going to be discussing the anatomy and physiology and the structures in the knee joints. So first we have the anterior view of the knee joint. We start with the three main bones of the knee joint: the femur, fibula, and tibia. Fibula, tibia. We then have the medial condyle and the lateral condyle, lateral, medial. They allow rocking, gliding, and rotating motion of the knee. Next we have the fibular collateral ligament. It stabilizes the knee joint on its lateral side. Then the tibial collateral ligament. That stabilizes the knee on its medial side. Then we have the anterior cruciate ligaments and the posterior cruciate ligaments. The ACL being responsible for preventing hyperextension and displacement of the knee joint during flexion, and the PCL being responsible for preventing hyperflexion and displacement during extension. Next are the lateral meniscus and the medial meniscus. They're both responsible for stabilizing the knee and preventing displacement. On this view, you have the transverse ligament. This stabilizes the menisci during movement. We have the patellar surface that holds the patella, the patellar ligament, which stabilizes the patella and prevents its displacement, the patella, the kneecap, and the quadriceps tendon, which connects the quadricep to the patella. We then move to the posterior view. On the posterior of the knee, we have familiar structures such as the femur, the medial and lateral condyles, the PCL and the ACL, the medial and lateral meniscus, the fibular collateral ligament, and the tibial collateral ligament, and the tibia and fibula. But we do see some new structures, one being the posterior meniscofemoral ligament. This develops tension during knee extension and stabilizes the knees. The posterior fibular ligament. This attaches the fibular head to the tibial head. Lastly, the interosseous membrane, which shifts compressive load between the tibia and fibula and separates the muscles from the front to the back. On to the sagittal view. The sagittal view also has familiar structures: the femur and the tibia, the PCL and the ACL, the lateral meniscus on both sides, the patellar ligament and the patella, and the quadriceps femoris tendon. There are a lot of new structures in this one. First, we have the suprapatellar bursa, which allows the quadriceps tendon to move over the femur when bending or straightening the knee. Then the subcutaneous prepatellar bursa cushions the skin from the patella. The synovial cavity is filled with synovial fluid, which provides nutrition, cushioning, and lubrication to the joint. The infrapatellar fat pad, which cushions and separates the patella from the shin and thigh bones. Lastly, the deep infrapatellar bursa. This cushions the patella and tibia as the knee extends and bends. Oops, almost forgot about you. The articular capsule stabilizes the knee joints on its fibrous layer and nourishes and lubricates the joint on its synovial layer. Lastly, we have the superior view, which we've all seen this stuff. This is the transverse ligament, the lateral meniscus, the medial meniscus, the PCL, the ACL, and the posterior meniscofemoral ligament. Oh my god, I can't believe I said that right the first time. That's all. Thanks for watching.